Welcome to this free public webinar presented by the Global Health Fellows Program 2, a USAID program implemented by the Public Health Institute and its partners. I'm Sylvie Rousseau, and I'm excited about the presentation we've prepared for you. It's really great that you're able to attend. We have more than 400 registered participants representing more than 150 institutions. I think that you will find the information interesting and useful. We've received your questions, and we appreciate them. We've attempted to weave the answers into this presentation, but you'll have opportunities to ask more questions throughout, and we'll answer them as time allows. Keep in mind that we're giving you guidelines, but when you're applying for various positions, please read and follow specific directions from other organizations. Our advice and tips are guidelines based on our recruitment practices. Also, we're not speaking for the U.S. government, so please keep that in mind. I'm sure you're eager to get started, but before we begin, we have a few housekeeping items. As I said, I'm Sylvie Rousseau. I'm the Outreach, Social Media, and Communications Assistant with the Global Health Fellows Program 2. I'm so happy to welcome everyone to this webinar. We realize we have many students and university faculty and staff with us, so thank you for attending during the lead up to final exams and final projects. Thank you also to the many career changers and different kinds of professionals that we have joining us today. I can assure you this webinar will be very full of useful new tips and for some people reminders about how to begin your career in the field of global health. Themes that we'll be addressing in this presentation include letting your passion for the work shine through, being sincere, and also being realistic about the job opportunities available. We want to remind you that material should always be relevant to the position you're applying for, and in that vein, to tailor your application materials to each and every position and to the organization that you've been so moved to apply to. Please note that a transcript of the spoken content will be available after the webinar. Also, there will be a video recording. Both will be available for download at www.ghfp.net about a week after the webinar, and the video recording will be on our YouTube page. We're happy to offer closed captioning with this webinar. For Windows users, there will be a column of useful panels on the right-hand side of your screen. For Mac users, it will be on the left. These panels are resizable and collapsible. Live closed captioning is available in the Media Viewer panel. Let's go there now. You can click the text link, Show Hide Header, to give more space in the panel for the scrolling closed captions. This is going to be an interactive webinar. We're going to be soliciting different kinds of feedback throughout. There will be times when an activity in the WebEx window might temporarily cause another panel to collapse. Don't worry, you can always bring back the panel you'd like to see by selecting the corresponding icon from the top of the window. The icon for the media viewer, which houses the closed captions, looks like a circle with a snippet of film in front of it. Click this to bring back the captions. For additional technical help, you can submit questions in the Q&A throughout the webinar. Star Tiffany and Joanna Hathaway are our colleagues from Dialogue for Health. They are here to help you. Please take a moment to write down this phone number in case you need to call for technical assistance. You are welcome to call the phone number or submit technical questions in the Q&A at any time. Again, the phone number is 866-229-3239. We also welcome questions about the content of our webinar through the Q&A panel. Please note that you should direct your questions to all panelists. We have set aside 30 minutes for Q&A during the webinar, so we'll try to answer as many of your questions as possible given the time. You can ask questions at any time. Please remember to submit them to all panelists through the Q&A. All right, let's get to it. So we've completed item 1. The next parts of our presentation will be a journey through the world of global health through the eyes of various participants. Next, intern Jamie Gao will be talking about her experience this past summer working at USAID in Washington, D.C. Then we'll have a program overview, giving you some details about the internship program, which I'm sure many of you are very interested in learning more about. And then we'll be giving quite a lot of career advice, tips about applications, about networking, etc. So we've called that section Being Bold, Being Brave, and Being Prepared for Global Health Internships. And finally, we're going to wrap up with Q&A with a number of other panelists. We're going to have some poll questions throughout the presentation, and they will help us gather feedback. So I'm Sylvie, the moderator, and our presenters will be Fernando Fuentes, Jamie Gao, and Bob Leone, and we'll have other GHFP-II staff joining us for the panel. So I mentioned a poll. We are going to actually have a poll in a few seconds, but the polling feature is going to pop up on your column on the right-hand side for Windows users, on the left for Mac users. Please choose your answer in that panel and then click Submit in the bottom right-hand corner. As a reminder, you'll be able to reopen the media viewer, which has the closed captions from the top of the page. Okay, so Star, can you please open polls 1 and 2? Okay, so the first question we'd like to ask, how familiar are you with GHFP-II? Are you very familiar, somewhat familiar, not very familiar, not familiar at all, but I like what I see? So please select your answers for both questions 1 and 2 as I'm speaking. We'll have about 2 minutes and 30 seconds to complete those. Poll number 2 is, where do you primarily search for internship opportunities? And for this question, we ask you to select all that apply. Do you search through your school, including from teachers, classmates, and email lists? Through LinkedIn and other social networking sites? Through a specialized global health job site like DevEx, ReliefWeb, International Career Employment Weekly, or etc.? Do you search through general job sites or other? And if you search in other, please type your answer and submit it in the Q&A to all panelists. We'll be sharing the results of these polls a little bit later, so please take a couple of seconds now and answer polls 1 and 2. Now I'd like to introduce Bob Leone. He's our first speaker, and he's been working in global health for 12 years and advising many students and professionals at different stages of their careers. Bob, go ahead, please take it away.
Thanks, Sylvie. A career in global health can be exciting, rewarding, and varied. It offers many opportunities to utilize your skills and experience in ways that impact populations around the globe. A global health career will also have high levels of complexity that can be challenging. But where do you begin? The good news is that there is no single path to a global health career, and I'd like to show you some recent GHFP-II interns and the paths they're taking to achieve their goals. So let's start with Jonathan DeWitt. There are many different aspects of global health that people might find compelling. For Jonathan, it was the large-scale impact of global health work and a strong interest in a particular population. Some of the things we'll be talking about may strike a familiar chord, or you may have other reasons to be interested in global health. It's great either way. You have the motivation, but you may be wondering what a career in global health looks like. Jonathan began his career with a non-health college major. But one remarkable experience as an undergrad caused him to turn his attention to global health issues. While attending a seminar on the then-new PEPFAR, President's Emergency Plan for AIDS Relief, Jonathan had a strong reaction that inspired him to travel to Jos, Nigeria for 4 months, despite some misgivings from his family. In his words, "I found incredible value in working outside of my comfort zone." In Nigeria, Jonathan worked in an HIV/AIDS clinic. He remembers, the clinic had just recently received PEPFAR funding and subsequently antiretroviral treatment to provide for HIV-positive clients. I saw firsthand these drugs saved some lives, while at least 1 person a day died in the clinic from advanced AIDS. I worked with the incredibly overwhelmed staff of the clinic in sometimes horrifying conditions. Returning to the U.S., Jonathan realized that he wanted additional education to pursue his new global health career goals and enrolled in an MPH program. Between the 2 years of study, Jonathan was a GHFP summer intern, but it almost didn't happen. He says, "I almost didn't apply for the GHFP internship because I assumed that I wouldn't be competitive since I wasn't a student at an elite global health school. I learned from my experience with GHFP and other opportunities that if you're interested in something, you should put yourself forward." We're so glad Jonathan did step out of his comfort zone and applied for the position. As part of his GHFP internship, Jonathan developed the Asia Regional Consultation on Care and Support for MSM, Men Who Have Sex with Men. Preparation for this meeting involved reviewing the global literature on the topic, presenting these findings to key stakeholders in the Asia-Pacific region in order to help them engage in the issue. He traveled to Thailand to serve as a key presenter on the use of technology to reach MSM in a culturally sensitive way. Finally, Jonathan served as rapporteur for the meeting, condensing the key recommendations into the summary report published internationally following the regional consultation. After graduating, Jonathan worked for the National Association of Counties in Washington, D.C., taking the opportunity to increase his public health experience in domestic issues. Then he worked on an HIV program in Ndola, Zambia. He's very proud of the work he did in Zambia. Having never served in a management position prior to that experience, he was unsure how he would function leading a large staff overseas. But he found success even in this incredibly ambitious project, including securing additional funding in his first attempts at grant writing. Jonathan was considering pursuing medicine when he joined GHFP, but over the summer he was able to clarify his personal career goals. He said, "The work I was involved in at USAID was so engaging, so relevant, and so inspiring that I knew very quickly that I wanted to work on broader reaching programs and policy making." About his career, Jonathan says, "I hope to be part of the movement to help governments recognize the effects that marginalization of MSM has on the health of the broader community. Institutionalized intolerance can have deadly consequences. I'm passionate about creating avenues for providing quality services to MSM while protecting their social identities." Or maybe you're like Nikel, whose skill set and readiness to accept challenge drives her passion for global health. Nikel Brown is an engineer. She studied industrial engineering and health systems, earning her bachelor's and master's degrees in quick succession at Georgia Tech. She has one piece of advice for someone considering an internship with GHFP-II or a career in international development. Just do it, especially if you have an analytical mindset. The international development community needs engineers, mathematical modelers, statisticians, and epidemiologists just as much as it needs experts in health behavior, international affairs, and social work. If you have an educational background that doesn't typically feed into global health, branch out, and I guarantee you won't be disappointed. Following her own advice, Nikel branched out. She became a GHFP intern and worked on 3 main projects during her commodity security and logistics internship with USAID. One was an analysis of the shipment network for reproductive health commodities and identifying opportunities for improved efficiency. Another was a statistical analysis of correlation between volume of commodities and prevalence rates of contraceptives in priority countries. And the third was development of a supply chain evaluation tool for priority countries. One thing Nikel learned about during her summer in Washington, D.C. is that all of USAID's work and all global development work is highly contextual. Family planning brings another layer of sensitivity into the equation. Nikel valued the country visits, seminars, training, brown bag lunch learning sessions, and more that allowed her and her colleagues to keep cultural sensitivity at the forefront of programmatic decisions. After her internship, Nikel enrolled as an epidemiology PhD candidate at the University of Southern California. Her passion for evidence-based development drives her work. Nikhil sees that USAID is in a position to analyze past successes and learning opportunities to build its 21st century legacy. How do we use the information to make the big decisions? Are we collecting the right type of data? Are our incentives and metrics aligned? These are the global health questions that excite her. Nikhil loves numbers and data. Since she's interested in applying her skill set across a broad range of projects, she knows she'll have to invest time in learning the intricacies of each contextual setting. But in her words, I'm up for the challenge.
And now we'd like to introduce, thanks Bob. We'd like to introduce Jamie Gao, who was a global health intern with us at USAID this past summer. Jamie Gao is from Brookline, New Hampshire, and she has quite a bit of experience that she'd like to share with you. Jamie?
Hi, everybody. Thank you so much, Sylvie. I'm really excited to be here and presenting to you. I was actually in your shoes last year attending the webinar at this time. I remember being at my other job and trying to hide the fact that I was on it over my lunch break. So I'm glad to be here. I'm going to give you a quick background on what I did before coming to this internship in USAID, because I think some of those experiences were obviously relevant and have fed into the work that I'm doing now. So I graduated from Bucknell University with an undergrad degree in international relations and sociology. I had been living in DC and stayed in the area to attend school at George Washington University with a focus on global health, program design, monitoring, and evaluation. Oh, thank you. I had the opportunity to intern as part of my school practicum for those of you that are pursuing MPH degrees. I applied to this UNICEF opportunity through my school, and I just wanted to highlight that because I want to emphasize how essential your school networks can be in providing opportunities. And I want to really encourage everybody to look into what is available to you because it can open a lot of doors. That UNICEF experience was invaluable to me, and I think in the work I'm doing now with the Center on Children in Adversity, having come from that child protection space has been really helpful. I think it was probably one of the reasons that my application stood out. I also spent 18 months throughout the course of my MPH classwork interning at the Campaign for Tobacco-Free Kids in their Latin America region, or with their Latin America group. And prior to working there, I had spent a year in Peru managing a really small program called Girls Sportworks. And that program uses sports as a means of empowerment, teaching life skills to girls that might not otherwise have after-school opportunities. And the reason I run through all of that is to say that for Girls Sportworks, at least, that wasn't an opportunity that I was necessarily looking for. A friend and I were hoping to work somewhere for the summer to work on our Spanish, and we came across this year-long opportunity. And we were both in graduate programs at the very beginning of graduate programs at the time. And we looked at that and said, gosh, you know, this is such an amazing opportunity to get international experience. It was volunteer, but it was paid. And we decided to go for it, to apply, to see what happened. We were able to get it, and I feel like that opportunity has opened so many doors for me in terms of being able to then intern at the campaign and then being able to go to UNICEF and work in their Latin America and Caribbean office. So I just wanted to highlight those as in global health, you can't necessarily plan everything, and I think that it attracts a certain type of people, and you really need to be willing to be flexible and to seize those opportunities to have success in this field. And I just wanted to highlight one other thing. I noticed what was said about Jonathan, one of the past interns, that he almost didn't apply. Like I mentioned, I sat in on this webinar last year, but when it came time to apply, I had a million things going on with school and work and had kind of pushed it off, as sometimes happens. And I'm so glad that I did because the experience has been invaluable, as I'll talk about, and it's led to what I'm now doing. So to those of you that may be on the fence, definitely apply. And not only that, my background at school had been in monitoring and evaluation. And so when I looked at the internships that were available, I was really interested in an M&E position, but didn't necessarily have a lot of work experience in that. So the position that I ultimately ended up getting, the Children in Adversity work, I had work experience that lent itself well to that, and I had an interest in the child population group. So I decided, you know what, that one sounds like something that I may have an opportunity. People may read my resume and say, oh, this girl is appropriate for that. So don't be afraid to go beyond what your specific interests are when you're looking at what's out there, because I'm now doing monitoring and evaluation work, and I didn't know that when I was going into the internship. So I'll move on to the next slide. I want to highlight a couple of projects of my own, but I also want to talk about what some of the other interns were able to do, because I can't say enough how many opportunities we got to really do substantive work. So I came in thinking I would be more of a communications intern, helping to develop a strategic plan and key messaging and things like that for the Center on Children in Adversity, which is relatively new within the Bureau of Global Health at USAID. And while I did that for the first couple of weeks, once we had gotten something developed, well, I'll back up for a second. My very first day, I grabbed lunch with some of the fellows, and I was talking about my interests, and I said that I had an M&E background, and the technical advisor for monitoring and evaluation, his ears kind of perked up, and he said, "Oh, really? We didn't know that, but we could definitely use help with it." And so over the course of the 5 months that I was interning, I was really able to step into a role of helping him to develop some of the work that he's doing. So again, to emphasize that flexibility and how important that can be, and being willing to change directions, that'll just open so many doors for you. So some of the projects really quickly, most recently my time has been taken up with something called a global classroom, and it's a virtual classroom that we're hoping to disseminate to universities in the Global South. And I'm happy to talk about this offline, but I won't, or get into it in the question and answer. I won't bore you too much with my own projects, but I do want to say, in the summer, there are about 25 to 30 interns that are there, and so many times throughout the course of the summer and this fall, I would walk into a meeting, and an intern that I sit next to, a good friend, I had no idea what she was working on, and she would have been sitting at the table, and it turns out she was really driving one of the new policies in monitoring and evaluation, for example. Or to give another example, another intern was working with the Office of HIV/AIDS, and he was doing a lot of indicator development, and it had a lot of overlap with our own work. So the people that you work with, the interns that you're surrounded by, are a really great group of people. Everyone's doing fascinating things, and you stand to learn so much from them. And that's something that I didn't know or didn't necessarily expect going into it, and that's a real benefit that I'm looking forward to staying in touch with these people, seeing where they end up, and I expect that these will be contacts that I have, hopefully throughout the course of my career. So I'm going to tell you a tiny bit about my actual team, because we're a little bit unique. We are a cross-cutting issue. Childhood adversity is something like gender, where it spans a lot of these different groups. And everyone's internship experience will be different and was different. So take what I'm saying with a grain of salt, but that doesn't mean that interns don't do a ton of work, because they do. Okay, and then my next slide is just to talk about my team. My team is a really tiny group. We have about 6 people, and that smallness lends itself well to the opportunity to get involved with anything and everything that you are interested in, and to really see the impact that you are making on your group, and to be able to help out and do things that the team maybe wouldn't be able to do without you. I've already mentioned that the other interns are a great cohort. We would do happy hours, and we would go out, we would attend different career development meetings together and kind of share information, and that was a really great benefit. USAID is so big and complicated and exciting that to have those people that are going through the same experience as you is something that helped enhance the experience for me so much. We learn something new every day. I'm still learning. And I want to highlight one story that I think is relevant. The team here asked me to weigh in on what was unique about the internship, something maybe you didn't expect. And I remember my first couple weeks working with the team, we were struggling with some DHS data. Those are the demographic and health surveys. And we were interested in looking at a certain population, and we couldn't quite get the information that we needed from the existing surveys. So normally, if you're in, I don't know, when I was in school and I was looking at the DHS, I was able to download it offline and kind of parse through it on my own. But in this case, because you're at USAID and you have this convening power, we were able to just call up the contacts at UNICEF that do the mix studies, the multiple indicator cluster surveying, and we were able to call up the Measure DHS team that actually administers the surveys and say, hey, this is something that we're struggling with. what kind of information can we get from here? How can we think about this differently in the future? And that for me was really a wow moment to say, oh my gosh, I'm here at USAID, such a huge player in the global health field, and that experience was just kind of shaped my thinking as I went forward, and I realized how exciting it is to be at the table with those decision makers. One thing I do want to highlight about USAID is that I've realized is that it really is more of a management agency than you necessarily having your hands in these programs. You're not an implementing partner, but you're kind of overseeing the policies and the projects and kind of directing the work that's being done. And that can be really exciting. For me, I always thought I wanted to be on the program side. I'm so thankful to have this experience so that if I ultimately end up on the implementing partner side, I'll have a much better sense of how decisions are made and what type of work gets done. The last thing I'll say is that I recently transitioned into the role of monitoring impact and reporting measurement advisor with my current team. It's the Public Law 10995 Secretariat and the USAID Center on Excellence on Children in Adversity. And while I don't think that's necessarily typical of all interns' experiences, again, everything is so unique, I obviously would not have had the opportunity to transition into that role without having done the internship. So I want to say definitely apply, definitely put yourself out there, look for opportunities that your interests lend themselves well to in your experiences, and if you have any questions, I'm happy to touch on that during the Q&A.
Thank you so much, Jamie. Those stories that you shared and the work that you're doing are really fascinating. And I think, on my end, I was learning new things as you were talking, so I hope that our audience is also gleaning some information here. We are now going to open poll number 3. And poll number 3 asks, what are some barriers to careers in global health? And we're really asking you to share from your experience. So what are some barriers to careers in global health? And please select all the options that apply. Unfamiliarity with the field in general, financial barriers to getting experience or education, gaining developing country experience, family concerns and resistance, or something else. And if it's something else, please do type your answer and share it with us in the Q&A, addressing that to all panelists. So you have about 2 minutes to answer this poll, and please hit submit. And now Bob is going to be coming back and talking to us a little bit about the program.
Thanks, Sylvie. Before we get to the practical information about how to make yourself stand out in a crowded field of applicants, I'd like to take just a few minutes to offer some information about GHFP-II and the U.S. Agency for International Development. So what is the Global Health Fellows Program, II, and how does it fit into the larger goals of the U.S. Agency for International Development and the work being done in Washington, D.C. and overseas? As our name indicates, we're in the second iteration of the Global Health Fellows Program. The first was from 2006 to 2011. The program engages in activities that span the geographic reach of USAID. We do this primarily through internships and fellowships and by providing professional development and career management services to those who participate in our program. USAID is the largest development organization in the world. It serves as the development arm of the U.S. government and implements the U.S. government's foreign assistance agenda. Within USAID, global health is the largest portfolio, exceeding $5.5 billion in fiscal year 2011. Within the broad field of global health, USAID divides its work into environmental health, family planning, health systems, HIV/AIDS, infectious diseases, maternal and child health, and nutrition. GHFP-II works with USAID in all these areas and more. Virtually no area of the world is outside of the agency's work, as you can see from this map. The Global Health Fellows Program, II, is one of several initiatives that allows USAID access to diverse talent to address its long and short-term needs. GHFP-II is unique in its combination of opportunities available and the professional and career development we offer to individuals participating in the program. In general, GHFP-II interns and fellows are GH professionals at different stages in their careers. They are motivated, technically excellent, and representative of the diversity of the American people. and committed to USAID's success in key global health areas. Although our fellows and interns work within USAID, they are employees of the Public Health Institute, the lead partner in GHFP-II. Headquartered in Oakland, California, PHI employs over 700 people, implementing more than 200 different projects, ranging from alcohol research to disability programming to international leadership development. Our GHFP-II partners include Global Health Corps, who offer one-year junior-level fellowships. GlobeMed provides overseas internships for undergrads. Management Systems International helps support fellows' professional and career development. And Pixera Global, whose programming focuses on short-term private sector opportunities. A word about GlobeMed, especially for you undergrads that are out there. They reach over 2,000 undergraduates a year through 50 university-based student-led chapters. If there is a GlobeMed chapter at your school, it's a great place to start exploring your career options in the field of global health. And if there isn't, you might want to consider starting one. More information about these partners can be found at www.ghfp.net. As you can see, fellows and interns have worked in a variety of locations. Countries listed in regular text are those where we've had or currently have fellows, while those countries in red are where we've had both fellows and interns. Lastly, countries listed in blue are those where we've had interns only. Currently, we have approximately 120 active fellows, and we'll have a cohort of summer interns on the program in 2014, working with USAID in Washington, D.C. There are also several on-demand internships that come up throughout the year. These USAID-based internships each have specific requirements ranging from completion of an undergraduate degree to enrollment in a graduate program or recent completion of a graduate program. These positions are competitive, and a little later on, Dr. Fred Fuentes will be speaking about how to best present yourself within the context of your resume, application, and personal essays. Fellowships are at all levels, and the jumping off point for a junior level fellowship is an MPH or similar degree, plus 1 or 2 years of relevant experience. Each fellowship has its own very specific scope of work. The fellowships are for 2 years, often with an option to extend for an additional 2, with placements in Washington, D.C. and in developing countries. U.S. citizenship or permanent resident status is also required. Please note that while all of the work that fellows and interns do is global health focused, not everyone has a master's in public health. Many of our interns and fellows come to the program having studied business, social work, medicine, nursing, public administration, among other disciplines. More important than the degree's focus is a demonstrated passion and enthusiasm for the work that each individual brings. Areas that both interns and fellows have worked in are varied. This list that you see on the screen is not exhaustive. We currently have fellows working on animal-to-human transmission of disease, voluntary medical male circumcision, behavior change communication, pandemic threats, and other areas not listed. If it's done in global health, chances are we have an intern or fellow who has worked on it. So I just wanted to give you a little bit about some of the basic information that you'll need to know about the GHFP-II internships for summer 2014. So you'll see here some of the deadlines that are coming up, the qualifications, and more. This information is also on our website, and the positions will be posted there in a preview mode in late December. I'd like to thank all of you who took the time to submit questions to us in advance. We received quite a few, and they have been really helpful in helping us structure the webinar. I'm going to try and answer some of them now, and others will be woven in throughout the rest of the presentation. What are the qualifications for a GHFP-II internship? All the positions require that you be enrolled in school or have completed your degree within the last year. Each internship will have its own specific scope of work. You should review the openings available and then apply only for those positions that you feel are a good match to your skills, experience, and desires for the future. All internships require U.S. citizenship or permanent residence status. Most of the positions will require enrollment in a graduate program or having completed your degree less than 1 year prior. There will also be some openings for those with an undergraduate degree, and that is yet to be determined. The internships are also open to mid-career changers who are enrolled in or have recently completed a graduate program. Please note there is no age restriction. We have had interns at many different stages of life. Is an MPH required? An MPH is not required. Our interns are pursuing varied degrees, including MSW, MPIA, MPP, PhD, medicine, clinical nursing, and others. In fact, 45% of our fellows do not have MPH degrees. Some of our interns use our program to meet their practicum requirements as well. What does the application process look like? When you apply for a position, we screen through the resumes looking for the resumes and essays that speak to the requirements and experience that we're looking for. We then select the top resumes and forward them on to the hiring manager at USAID. The hiring managers select candidates to interview, and once interviewed, a final selection is made. An offer is then extended to the candidate after reviewing references. Then the onboarding process begins. One sort of tip would be to show that you have a need or a desire for the GHFP-II internship opportunity, not just to work for USAID, but that this opportunity really fits into your long-term goals. So what do interns actually do? As you saw earlier with Jamie Gao, Jonathan DeVitt, and Nikel Brown, each internship is different. You could be doing research, report writing, participating in technical working groups, conference calls with the field, traveling to the field for a site assessment, coordination with partners, collaboration on a project, data analysis, developing presentations, and more. Please note, interns will be working at the policy, program design, evaluation, and management level, not at the project implementation level. Is the content of the internships already set, or are they flexible in terms of what you can do? Each internship has its own scope of work, which can be broadly written, given that each sponsoring office is looking for a specific skill set. Once a finalist starts, he or she develops a work plan with their on-site manager, and that's tailored to the person's interests and the specific work needed done at the time. How does GHFP-II prepare and support interns in their careers? The interns receive a substantial amount of training, career guidance, and networking opportunities that will help them in preparing for their next move post-internship. Can this internship lead to a more permanent job with the Global Health Fellows Program too? As we saw earlier with Jamie, some internships have led to full-time positions, but not as a direct career path. And the vast majority do not by design. These internships are learning opportunities which are designed to be time-limited. Those interns who become fellows did so after completing their coursework and then openly competing for a fellowship. How do I gain international experience? This question comes up very often, and it is the classic catch-22 situation. You need international experience to get your first job, and it's difficult to get your first job without international experience. So it can be quite challenging. So I just wanted to put out there a few options and also some ways to make yourself a more desirable candidate. Internships, of course. Find out all you can about them during the application process. Peace Corps or a similar experience is also a great way. Volunteer positions, even if they're short-term. If you belong to a church that does overseas mission work, that's another great opportunity. We also recommend that you research and find ways that you can contribute to organizations based in the U.S., where an overseas opportunity might become available once you've proven yourself. I mentioned GlobeMed earlier. That's another opportunity. If there's a chapter on your campus, check it out. If not, and you're an undergrad, you could consider starting one. And you can find out more about GlobeMed on their website, which is www.globemed.org. Develop a good working knowledge of the political, economic, and social forces that shape the world. If there's a particular region that interests you, start there. Develop business and management skills, such as budgeting, project management, and people skills. Those are all very valuable in the global health environment. And learn another language. Also, be entrepreneurial. Your way into the field is going to require some creativity and the ability to see an opportunity and take it, even though there may be some uncertainty. There is no real cookie-cutter approach. It'll be different for everyone. This type of approach aligns very well with what global health employers are seeking in candidates. Note that not all overseas experiences are created equal in terms of applicability to our program. We're looking for experience in resource-challenged settings worldwide, not just any experience outside the U.S. So, for example, a semester in Geneva or Rome isn't nearly as relevant as working with the United Way in an urban area here in the U.S., or a health outreach organization in Appalachia, or a one-month volunteer or work experience with an NGO in a developing country. This is a question that comes up often. How many applications are usually received for the internships, and how many openings are there? There will be approximately 30 openings, and the number of applicants vary for each of those positions. Having said that, the internships are competitive with a large number of qualified candidates for each position. Do the internships allow for overseas travel? Very often there is overseas travel related to the scope of work, although that is determined on an as-needed basis during the course of the internship. And then finally, do you prefer candidates who already have substantial experience or those with limited experience? We view these internships as an entree into the field of global health, so substantial experience is not required. What is required is the demonstrated interest in global health and the desire to learn and also work on actual projects. Each internship will have its own specific scope of work, so you will want to read carefully the ones you are applying for and make the best case you can for yourself.
Thanks, Bob. Star, I was wondering if you could please bring up the answers to polls 1 and 2. So we have some results from those first 2 polls that we took, and I just wanted to share the audience responses with you. It looks like most people are not that familiar with Global Health Fellows Program. That's good. I'm glad you're all on this webinar so that we can offer some more information. And it looks like people overwhelmingly search for internship opportunities. It looks like about 51% of people search for internship opportunities primarily through their school, including from teachers, classmates, and email lists. Other large segments search in general job sites and through specialized job sites. Fewer search through LinkedIn and social media, and we had a few other answers. So that was great. Thank you. And could we see the results from poll 3, Star? Thank you. So the question was, what are some barriers to careers in global health? And it looked like the top 2 barriers that people cited were financial barriers to getting experience or education and gaining developing country experience, which Bob just addressed. So thank you. I did want to take a moment to remind people that we do have the Q&A feature, so you can submit your questions, but please do remember to submit them to all panelists by selecting the all panelists from the drop-down menu. So do keep those questions coming in, but address them to all panelists. And I did also want to remind people that we have the closed captioning available in the media viewer. The button is either at the top or the bottom of your screen, and it looks like a little film strip in front of a circle. All right, at this time, I'd like to introduce our next speaker, Fernando Fred Fuentes Jr., Ed D. And he will be speaking about really being prepared for applying for different global health kind of positions. And I'd like to welcome Fred, who was actually a participant in our program a long time ago, but we're glad to have him back now as a staff member. He's our lead for inclusion and diversity, and he has some really fascinating information to share with you. So please, Fred, take it away.
Thank you, Sylvie. And actually, thank you, Bob and Jamie, for your participation this afternoon. I hope everyone's enjoying this webinar. I hope you're finding it helpful. And I'll be talking about how to stand out. Some of the discussions, topics I'm going to be discussing include distance traveled, standing out from the crowd, the application process, essay questions, interviewing, final thoughts, and resources. So the concept of distance traveled captures the ability of an applicant for us to envision this applicant overcoming an array of life challenges. We consider during the application process the life experiences, circumstances, and personal challenges in addition to the applicant's credentials. And as an organization, we appreciate one's personal journey from wherever they started to wherever they stand today. In particular, the distance that they traveled between those two periods. But we're going to be talking about how to stand out, right? And people have very similar backgrounds and education levels. We heard Bob talk about how competitive it is, so we're going to try to provide you some insight on what you can do, or maybe things you're not doing right now that could help you stand out. So you're asking yourself, are you qualified for these internships? There's several variables to consider, whether you're currently an undergraduate or graduate student, whether you've graduated, if you're in that period in between, if you're a U.S. citizen or not, or a permanent resident. Those are also important as minimum requirements. But other things to consider include if you can work independently, what your skills are as far as proficiency in the computer and research. The title of today's presentation, Sylvie talked about this earlier, is Be Bold, Be Brave, and Be Realistic. So we encourage you to not undersell yourself. Share those school projects that you've done, the organizations you've been a part of. If you've learned another language or other languages, share those with us. If maybe you've been part of different community involvement opportunities, religious-based involvement, as Bob indicated earlier. Anything that you think is relevant based on that job description, definitely share it. And of course we mentioned, don't stretch the truth. That's never going to benefit anyone, right? So getting noticed. There are good ways, there are bad ways. We encourage you to be direct, engaging in your writing, use good grammar and accurate spelling. So you definitely want to use every resource available, whether that's a colleague, a mentor, to help ensure that your paper, that your essays and your application is error-free, and that you have complete and coherent ideas. We want it precise, well-written, complete sentences. Bad ways of getting noticed, because that's something to consider as well. Long, convoluted sentences. We have examples here, the last one of which is name dropping. Never beneficial. Not in this situation. So which one would you use as far as a summary of qualifications or objective statement? As you guys think about that, we'll go ahead and talk about an example of an objective statement. Here, and I'll read it. I'm seeking a position in global health that will allow me to gain experience so that I can reach the next level in my global health career. I'm interested in overseas travel, and my goal is to work with the HIV/AIDS program in sub-Saharan Africa. Sounds good. But maybe this is something that you want to use in your cover letter, not as a statement on your application. What we're going to suggest is a summary of qualifications. Here is an example of one. Recent public health graduate with experience in working with diverse partners, ability to establish and meet deadlines, involving multiple stakeholders, and a strong interest in exploring the e-learning format and how it can be utilized in a global health setting. This reflects a prepared and knowledgeable applicant. It states what you have to offer the organization, how these skills relate to the position, and indicates you've actually read the scope of work. All very important in the process. All right, so what doesn't work in applications? Talked about it earlier, name dropping, that's not going to benefit you. And of course, you're strongly encouraged to maximize your educational experience by taking every opportunity to demonstrate your commitment in the field, in your field of interest, while you're an undergraduate and graduate student. So if you're not working, definitely take advantage of those opportunities, as indicated previously, to volunteer or give up your time. It does look great on your CV and resume. As far as fundamental skills, being aware of who you are is important. We don't want someone potentially representing our organization or the U.S. people who's not sensitive to others. So here we talk about the ability to interact effectively with people from cultures different from your own, ability to interact effectively with colleagues from different organizations and agencies, and the ability to work effectively in a resource-constrained setting. And I think you heard some of that from Jamie earlier, talking about her personal experience. So if you want to hear more about that, definitely ask her in those questions that Sylvie suggested earlier. How does your work differ from school? Well, you want to look into where you wish you could work, places you want to work, and prepare for that opportunity. With that, you want to focus on organizational needs. What is the office stating they want? What kind of candidate are they looking for? So translate that academic work into professional language so they understand those achievements that you've done. Produce measurable results, and then do the best job you can in the job you're in. And that's how you get the next one. All right. So the art of the application. Resumes are more than a laundry list. So keep in mind, when we say research the organization, and that was definitely referred to earlier, can't say that enough. Very important to know the scope of work. So when you're applying for those positions, internships in this regard, you definitely want to know what they're looking for, and then you mirror your essay so that it complements that same goal. So it's hard work, definitely highly competitive, but worth it. And you heard Jamie talk about that earlier. So here again some helpful hints, including researching the organization, carefully reading the scope of work, using the scope of work to determine the most important skills and experience, connecting your scope of work to your own resume, putting relevant skills and experience front and center, keeping it short and relevant, and then leading the recruiter or hiring manager through your material. You're the expert. Okay, the essay questions. Some of you who have already looked into our website and applied or are strongly interested in applying know that these are our questions for this year. So I do have some information to share on this, but if you want to know more about this, definitely visit us at our website. But as you look at these questions, it gives you an insight on what we're looking for. And these are the kinds of questions that help us find the best candidates. So during this process, take your time, write an error-free, well-written essay that reflects why you're the best applicant or candidate for this particular scope of work. Here we're looking at number 1. You enter an elevator in a lobby, going to hear a lecture on the 30th floor. Indication that it's a long trip. As the doors close, you realize that the person who is hiring for your dream job is standing next to you. What would you say about yourself during that ride to convince him or her that they should interview you for that job? So this is what we call our elevator speech. So 30 to 60 seconds to introduce yourself. Hi, my name is Fred Fuentes, and you go into that. I'm currently the lead in inclusion and diversity. So you share who you are. Take that opportunity to get that interview. All right, so crafting your essays. We just saw what the essays look like. It's extremely important. And here we're giving you advice on where we get that first image of who you are. So we're encouraging you to be succinct and cogent. Tie in your life experience. Focus on what you have to offer. Be clear, persuasive, relevant, And then, of course, while writing your essay, you definitely want to demonstrate your commitment. Okay. So before the interview, some of the things you can do to prepare, you definitely want to have the knowledge of the scope of work. You want to research the organization. This is important as you prepare those questions prior. And some of those questions include anticipating interview questions that they may be asking, in our case, what we will be asking, and even questions that you have for that organization. Be prepared for standard questions or even trick questions. Questions like, what is your greatest challenge? So be able to be honest about where you could benefit from. Be prepared for questions like that. Review your resume. Prepare those questions for them prior to ending the interview. And you want to practice. All right, now the actual interview. Let's say you get called in. You have the wonderful opportunity to interview. You want to answer each question in its entirety, even taking notes or bullet points while you are asked a question. Pay attention to those, be prepared for those technical and behavioral questions, because you'll get them. And of course, a solution-based answer to questions that they have. Afterwards, you definitely want to take some time to thank the interview team, gather their card so that you have their contact information, and then send a follow-up thank you card or note. But you want that to be relevant. So you want to touch on some of your points. This is an opportunity for you to correct anything you may have misconstrued or expand on some of the subjects you guys talked about during the interview. It's an effective method and will make you more memorable. Okay, let's say you had an interview, but it's going to have to be done over Skype, so you're on camera, right? So you definitely want to test run that technology. Focus the camera on you. Ensure there's adequate lighting. Look straight at the camera. Have a plain background, nothing too distractive. You definitely want it to look clean and professional. Smile, don't forget to smile, and have proper posture and dress appropriately for the interview, even if it is on camera. So let's say you have to do a remote interview. Keep in mind those surroundings. Location, you definitely want a location that's quiet. A phone that's charged, ready. A landline is preferable. No distractions, and have a paper and pen handy so that you can write down those questions. And of course, the questions you already have previously. Let's say you get the opportunity to do a remote interview. Definitely want to identify yourself when you answer so they know who you're talking to. You answer professionally. You have saved a voicemail on your phone that's professional. You know how to handle panel interviews, so be prepared if you walk into a room or through this remote interview, there are several people online talking to you. So have that positive voice and demeanor, bring your confidence, and if you need, ask them to repeat the question, listen carefully, speak clearly and concisely, and write down those important points. Let's say you have the opportunity to do an in-person interview. All the same applies, all these important hints. Here you want to arrive 15 minutes early, giving yourself time to settle your nerves prior to the interview. And also be prepared to handle panel interviews. This can be intimidating as well, especially live with 2, 3, or 4 people looking at you during an interview. Have your paper and pen. You're dressed professionally. Also have your business card so you can give to them and then ask them for theirs. And of course, bring your confidence. Final thoughts. Don't half submit your application. If you're going to do it, work on it, take it serious. You definitely don't want to waste our time or yours. Your essays should be unique. This is your essay. It's your opportunity to talk about your compelling story. For the third time, don't name drop, right? And if you don't apply, you can't be considered. So take that into consideration. Additional final thoughts on global health careers. This reflects, these essays and this opportunity reflects who you are and your passion. So we encourage you to stay involved in your community, stay current with news, trends, those skills and technology. Never burn any bridges. You always want to transition from your experiences professionally, and definitely try it out. Resources, we have a list of resources here. I'll summarize by encouraging you to utilize those university contacts. Look at your career from an employer's perspective. Remember to develop that elevator speech. And of course, join the GHFP-II listserv at www.ghfp.net so that you can receive internship and fellowship announcements throughout the year. Best of luck, guys.
Thank you, Fred. That was a very thorough capitulation of everything that, the skills that people need as they're applying and moving forward with job prospects. I did want to take some time to remind people that we are still accepting answers in the Q&A, and that you can bring back the closed captioning in the media viewer panel. The Q&A should be submitted to all panelists. As a reminder, we're getting a lot of great questions, so keep them coming. We have a Q&A panel coming right up, so get your questions in, and we will consider them for live answers. And now we'd like to open our final poll of the day. We want to ask, given the information that you've received, what are some of your next steps? So you have a minute 30 seconds to answer this poll, and we want to ask you what your next steps include. Researching USAID, thinking about how you will address essay questions, revising your resume to make it a more effective tool. If you have any particular revisions that you're thinking of making, please type those answers in the Q&A and submit them to all panelists. Okay. Now I'd like to introduce our Q&A panel. You've already met Bob Leone, Fernando Fuentes, and Jamie Gao, who are our presenters today. And I'd like to introduce Jennifer Russell and Jennifer Kaindi. This is our recruitment team here at GHFP-II. So Jennifer Kaindi is our lead for recruitment, and she has a long history working with global health organizations in recruitment. Jennifer Russell also has quite a bit of experience working in recruitment, particularly with global health organizations. Between them, they've reviewed thousands of resumes and hired hundreds of candidates for global health positions. And so we are pleased to have them with us to offer their perspective on hiring processes, especially that which we have here at GHFP-II. All right, so we will open with a practical question. I'd like to ask Jennifer Kaindi. Some people are asking about different graduation timelines, and we want to know what is a recent graduate in terms of eligibility for internships. Jennifer?
Thank you, Sylvie. Hello, everyone. We just actually redefined for our undergraduate positions or internships. We are requiring at least 2 years, not to have been outside of graduating for 2 years. This is because we get a lot of people who have either gone to Peace Corps, which requires about 2 years, but when we want to make sure that they are eligible to apply for such for our internships and great experiences. But for the master's degrees, we only require 1 year out of graduation. So that means by the time we hire you, you shouldn't be more than 1 year out of school from your graduation date. Thank you.
Thanks, Jennifer. The next question we wanted to ask is if you have any tips for applying when you're coming from a different field outside of public health and you don't have any global experience or global health experience or background. And I would like to open this up to any panelists who would like to answer. Maybe Fred, you could answer this question. Any tips for applying when you're coming from outside of the field of global health?
Yeah, that's a good question. I can talk about myself. Definitely not an MPH student when I applied, and looking sometimes at the website or different resources can feel intimidating if you're not coming from that discipline. But what I would encourage you to do is look at those essay questions and take an opportunity to really share who you are. I talked about it earlier, and sharing your compelling story, the distance traveled component of your interest, your experience, where you volunteered, and your passion and why you want to work in this field or why you're interested. There are opportunities for individuals who maybe have not taken a traditional track. So I would encourage you to not be discouraged, to stay confident, to find a mentor, someone who's in the field, someone who's gone through those experiences, and model your actions in a way that make you a competitive candidate.
Thanks, Fred. This is a similar question, and there is somebody asking for suggestions for students who don't see global health opportunities on their undergraduate campus. How can they find opportunities outside of their undergraduate university? And I'd like to ask that of Bob.
Thanks, Sylvie, for that question. Well, I think that looking for opportunities outside of your campus could involve a couple of things. One is doing some research on your own, looking for organizations that you think are a good fit for the path that you're interested in. So, you know, trying to find organizations that are kind of aligned with where you want to be going, and then finding ways to connect with them, doing informational interviews. Also, another great opportunity is attending conferences and being strategic in the way that you approach that. So, for example, you could go to a very large conference like APHA, American Public Health Association, where there are hundreds of organizations and you know, multiple presentations going on and workshops. But you really want to look at you know, use the program really as your guide and plot out the organizations that you want to connect up with, the presentations that you want to go to, and then again, do some research about the presenters, find ways to connect with them, and really what I'm talking about is networking and finding your way into the world of global health.
Thanks, Bob. Those are some good ideas. Another question, I see that many people are asking about their own experience and backgrounds. Jennifer Russell, is there any way that people can get individualized feedback on different career options in global health?
Sure. One thing that you could consider doing if you're kind of interested in global health and you're not sure if your background is a great fit, or you want to know what types of opportunities are available, is you could consider signing up for an informational interview with a GHFP-II staff. And there's information about signing up for an informational interview on our website. You just basically have to answer a few questions and send in your resume. But that can be one great way to kind of get some direct feedback. And you could also consider trying to have informational interviews with other organizations, too, that you're really interested in, trying to connect with staff and, going on LinkedIn and those kinds of sites, and just doing some research and, trying to figure out where your background fits in the field of global health.
Thanks, Jennifer. I have another question that could go to the recruitment team. This question is about applicants who wish to apply for more than one position. And you can apply for up to 2, but somebody's asking, would departments or the division that you're applying to find it less appealing if you apply for 2 internships as opposed to 1? Are you showing preference by not saying that this is absolutely your #1 priority?
This is Jennifer Russell. I would suggest signing up, as long as there are 2 internships that you're interested in, I would suggest signing up for both, or applying for both. I wouldn't really see that as an issue. And, you know, we've had people selected before for multiple interviews, and then they, you know, had to decide which internship they were more interested in. But I would definitely, to maximize your chances, I would say, you know, doing 2 great applications for 2 different internships.
We have one question that's asking about how to gain courage with a little bit of experience. How are you able to communicate effectively with important stakeholders? And I think that the question here might be posed to maybe Jennifer Kaindi. How do you take other skills and experiences and think about how they can apply in global health?
Thanks, Sylvie. Thanks, Sylvie. We might have not mentioned it in this webinar, but we have in other webinars, transferable skills. If you look at a scope of work and you know that you've done similar work, and we've kind of mentioned it actually, but just not called it transferable skills, but that's what we call transferable skills. You just need to be creative with the way you look at your experience and portray it in your application. So through your essays, and as well as making sure you can capture things that are relevant to the scope of work in your resume. So making sure your resume is tailored to the position always helps and gets you at least noticed. In terms of being able to sit with the stakeholders, I think that's actually a good question for Jamie, because she talked about being at the table with some of the big players. So I think Jamie should also, once you're in, how would you approach that?
Hi, thanks, Jennifer. I think that's a great question, and it can be a little bit intimidating, but one of the best pieces of advice that someone gave me, who's been in the field for a little bit longer, was that as a student, you really are in this excellent position of learning. So there's no stupid question. You can reach out to people and say, hey, you know, I'm an undergrad, I'm studying this, I don't know that much about this topic or this field. I read this article or I heard this thing and it just piqued my interest. How did you get started? Or ask them for 15 minutes to grab a coffee if it's, you know, if you're somewhere that they are willing to give that time. I found both as a student and then within USAID, that culture of sharing life experiences and mentorship is really there and common and welcome, and that most people, or at least some people, have gotten to where they are because they've taken advantage of those networks and the people that they come across. So it's kind of paying it forward. So you're in a good position to, don't be intimidated, just to, you are learning, and that's the point of being a student, and to take advantage of every opportunity to do that. And the more you do it, the easier it gets. I know for me, networking is not natural or necessarily intuitive, but I've found, you know, as I've had different positions and as I meet more and more people, that folks really are open to talking about their experiences and sharing any nuggets of information that they can. And it's not necessarily asking, hey, can I get a job, but just, hey, I'm hoping to learn from you. And so many times I've learned about new networks or different conferences or someone else that I should talk to that I never would have been able to have access to without, you know, starting that conversation. So I would say just do it. Be bold.
Thanks, Jamie. That's great advice. I have some process questions here, so some pretty practical questions, and I wanted to maybe ask them of Jennifer Russell in quick succession. So firstly, when is an in-person interview requested? Are interviews for internships in person?
So our internship interviews are actually usually held not in person, so they're usually over the phone. And I'm not quite sure if Skype is ever used, but I think typically, though, it is over the phone.
Okay, thank you. Is the internship paid?
They are, yeah. So our internships are paid at different levels. So at the undergraduate versus master's versus PhD level or mid-career changer. So they are paid at different levels, and you can find out more information about that on our website as well.
Thanks. Are recommendations due the same date as the application itself?
So we don't take recommendations. What we actually collect references. So when you apply and you create your profile, you write down the 3 different references that you want to use, and then if you're selected as a finalist, at that point in time we actually check the references. So we actually don't use recommendations, but we do check references.
Okay, thanks. We had a question about the location of the internships. Someone was concerned that most of the locations of the internships are in Washington, D.C. Can you address that, Jennifer?
Sure. So that's correct that all of our internships are, well, most of the time they're in D.C. Sometimes we do have overseas internships as well. And I think that's the case with a lot of global health internships, too. A lot of them are in D.C. And I'm not sure if that's kind of what the person was asking about. But, you know, and there are, if you are wanting to gain global health, you know, experience and location is kind of an issue for you, you could also consider, as Jennifer and some of the other panelists have mentioned, kind of the transferable experience you can gain doing, you know, domestic public health internships too within your community locally. You know, that could be working on food desert issues in kind of a local city, or working with new populations in the country. So there are ways that you can, if you can't relocate to DC, there are ways that you can also gain additional transferable experience by working within your community as well.
Thank you. And then I have a question for Fred Fuentes. For a new, somebody who's new to the field and somebody who doesn't have very many job experiences, can you talk about the length of the resume or the CV? How long and how detailed do you expect a CV for a new applicant or a career beginner to be?
Yeah, that's a good question. Definitely a difference between a CV and a resume. Your CV, of course, stands for curriculum vitae, and is something mostly used for master's level and above. So the literal translation is life work, and so the references, the document is used to provide your life work and the professional presentations you've done, the jobs you've held, research you've done, relevant experience, books you've written, or professional presentations you've conducted. So that all goes on your curriculum vitae. And again, so master's level and above, that's what's encouraged to be used. But for a lot of these positions, a resume is sufficient, and you'd have to look at the qualifications for that. But your resume is usually going to be a 1 to 2 page document. And that it's going to be directly relevant to the scope of work that you're seeking. Has been my traditional experience with those. I don't know if anyone else wants to add a little bit to that.
I have another question maybe for you, Fred. How does GHFP-II view military experience? Is it considered valid as overseas experience?
Yeah, another great question, and I would say absolutely. Your military experience is valid. It's extremely important. Bringing on more United States military veterans is also important to the company as a unique population. And of course, we do recognize travel within the military on deployments as international experience. And again, it always goes back to how you tell your story. When you write what you've done, how do you share that is extremely important. But yes, it is something that we strongly consider.
I had a question, and I'm not sure who might want to answer this, but the question was about specific advice for mid-career changers or people who are just finishing a PhD. Any advice for people changing careers a little bit later in their professional life?
Hi, Sylvie. This is Jennifer Kindy. I can answer that. Yes, we do encourage, and specifically for internships, we do have internships where they will consider PhD students, and we've had those types of interns, and we believe we'll have some this summer. And again, it's the way you convey your your experience. How transferable are the skill sets you have if they're from a different career versus the global health. But an internship is actually a great way to change careers and gain that initial global health experience. So I would encourage this person to definitely apply, or people with PhDs who are just graduating or in school currently, to apply for internships, and they will be available this coming summer. Thank you.
Thanks, Jennifer. And actually, this is another question for you. How could a person explain a gap in the resume due to maybe a family event? How would this be addressed in the resume, or should it go in the essays, or where can a person address some kind of gap in work experience?
Thanks, Sylvie. The essays may be one, and just at a very high level, we don't encourage anyone to provide us very personal information. It could be just that you took some time for personal or family issues, but please don't include or tell us what exactly those were, and for any position that you would apply. If it's any other position other than an internship, if it's a regular position, this could be addressed in a cover letter, but again, just very high level, took some time for personal or family issues, and that could go on your resume, but again, at a very high level, no personal or specific information. Thank you.
Thanks, Jennifer. I have a question for Jamie. Somebody's asking, have past interns used their GHFP-II internships to fulfill their field practicum requirements for MPH graduation? I know that this wasn't your experience, but did you see that among your cohort?
Hi, thanks, Sylvie. Now that I'm thinking about it, I'm not sure if people did do that, but it is certainly an option. It just takes a little bit of planning on the front end. So at least I know for GW, you needed to have a practicum advisor on site, and that involves some paperwork with the school. But absolutely, you could use that, and you can probably tell that GHFP is really here to support you and would be amenable to that type of setup if you were offered the position. And I'm sure you could work it out. So I would definitely encourage people to pursue that if that makes sense for you in the course of your degree.
Thanks, Jamie. We are running out of time, so I wanted to ask a few more questions. Bob, you were talking about the program earlier. Could you please clarify the difference between an intern and a fellow with Global Health Fellows Program 2?
Sure. Thanks, Sylvie. So the internships, roughly speaking, are the more junior level positions, and then the fellowships are the more senior level positions. And the fellowships are really full-time positions with USAID that last for 2 years, often with an option to extend for an additional 2. So it could be a 4-year total commitment. And but there's also a professional and career development component to the fellowships. And so those, those positions, there's the expectation that that person is going to have a substantial amount of skill and experience to bring to the table. But they're also at different levels, roughly junior, mid, and senior level. And while, of course, it will be in some sense a learning experience, there is very much the focus of that there's a job to be done. And so the internship is more of a combination of a learning experience and doing work at the agency. And they're shorter term. So 12 weeks, I think the up to 6 months is as long as we can keep an intern.
Thanks, Bob. And this is a question maybe for Jamie, maybe for Fred or Jennifer Kaindi. We were wanting to know what are some of the main skills that or competencies that that GHFP seeks, and what are some of these competencies that are necessary to be successful in global health careers?
Thanks, Sylvie. I can take a stab at that. Definitely, I would say teamwork is very important. I'm sure Jamie will talk about that. There are lots and lots of meetings, and being able to coordinate and work with others is, I think, very crucial. Interpersonal skills and being open and to working with people of different cultures. We have definitely lots of different and diverse people that work at USAID, including implementing partners, including calls with the implementing partners who are in different countries. Being able to work with different types of people and being culturally aware of other people's culture is definitely crucial to being successful in the internship program. I don't know if anyone else would like to add to that.
Yeah, Jennifer, I could add to that. Thank you for sharing. I definitely would state that those are things that we definitely look for and appreciate in our company. Being able to communicate effectively, being professional, having some patience, understanding that we're going to be able to adapt and overcome to different situations. So again, reflecting that patience and the ability to adapt. So those are different skills that we always appreciate as staff members, interns, and fellows.
Thank you, Fred. Thank you, Jennifer, Jamie, and Bob. I think that about wraps up our webinar for the day. We wanted to invite you all to stay in touch with us. We do offer informational interviews, as was mentioned earlier. We have some social media sites. You can email info@ghfp.net with general questions, and with particularly internship questions, you can email ghfpinternship@ghfp.net. So we invite you to stay in touch, and we thank you so much for joining us on this webinar. We hope it's been useful, and we hope to see you soon. Bye.